since the outbreak of the novel coronavirus disease pandemic. A simple and effective method, useful to obtain a proper segmentation of the typical pathological lesions of this infection in chest CT scan images, appears fundamental. Thus, our aim is to offer a starter pack of knowledge in order to let people perform an easy and efficient segmentation of these lung pathological findings. Hopefully, this will help the scientific community to develop dedicated radiomics and artificial intelligence studies that could improve the diagnostic approach of these patients.
From the DICOM browser of 3D Slicer, proceed to select the study you want to segment and click Load. You can review the selected case in the Viewer section. As you can see, this patient presents with ground glass opacities, bilateral and consolidative areas alike, which is a typical case of COVID-19. Then go to the Segment section and add 3 segments, one for the total lung volume, one for the ground glass opacities, and one for the consolidative areas. Go to the threshold instrument and set the upper threshold to minus 250 Hounsfield unit, so to select only air and leaving out soft tissues, bones, and consolidative areas alike, which the system cannot discern automatically from the soft tissues. Then click to apply.